So I think reforms to the 340B program are urgently needed to rein in the growth, particularly the growth in profiteering of the program. I lead a research organization, so I tend to leave policy suggestions to others, but I'm concerned about the growth of the program because the data shows that this program has gone up by about 50% over the last 2 years, and there's no sign of slowing down, and I'm concerned about the sustainability of the program. This buy low, sell high program is functioning as a drug markup program by hospitals, and I think it's really moving far away from the original intended purpose of the program. Many people think that this is a victimless crime, but the data is starting to show that employers are starting to become affected. I think IQVIA had some recent research that showed that self-insured employers are losing about $5 billion of rebate revenue, and state and local governments are seeing increased costs of around $1 billion as a result of this program. The National Alliance of Healthcare Purchasing Coalitions had some data this week that showed that the 7.5% higher claims costs they're paying in safety net owned hospitals is leading to about $36 billion in higher healthcare spending for them. So for those reasons, and the fact that the implementation of the Inflation Reduction Act through the Medicare Part D program is only going to create more overlap between 340B and the Part D program, I think that's what the data says the reforms to the program should be. So I think we've all seen the news reports about how hospitals are participating in the program. Again, I'm a researcher, so I tend to focus more on the data. I'm looking at reports from the state of Minnesota and the state of North Carolina that are showing how employers are being overcharged and how hospitals are wildly profiteering from this program. The National Alliance of Healthcare Purchasing Coalitions published new data about how employers' healthcare costs are starting to go up by the tune of about $36 billion a year. That builds on the work that IQVIA recently did that shows that self-insured employers are spending about $5 to $6 billion more on their drug costs, and it's costing state and local governments about $1 billion. And NPC just published some new research in the journal Inquiry, and what that research found is that these markups are happening more often and at a higher percentage in wealthier or more affluent communities. So those are the things that add up to me to say I'm not entirely sure that this program is functioning the way it was intended to, and we need to look at how hospitals are participating in this program. You know, it's hard to find anyone who would disagree with the original intent of this program. And as someone who takes their own mom to a federally qualified health center for her routine care, I understand how important this program is to underserved areas, particularly rural underserved areas. I believe it was IQVIA that did some recent work that found that the state of South Dakota, employers in that state may be spending $57 million more because of the 340B program, and the new legislation that was passed has a potential to increase that higher spending to about $80 million. So I think those are some of the reasons why I think all states, particularly South Dakota, should be having a serious conversation about this program and how it's working in their state. So I'm not a policymaker and I don't have a crystal ball, but as a pharmacist, I believe that prescription medicines are something that help people get well, stay healthy, and avoid higher cost care settings. Unfortunately, 340B is one part of a healthcare system that is rife with perverse incentives and now seems to be favoring drugs as an arbitrage opportunity to extract margin. But it's not just 340B. When I think about prescription drug affordability boards, commercial gross to net spread. I think all of these things function in a way that isn't necessarily helping patients. And if we keep taking little cuts out of this industry, we have the potential to hit an artery.